Hello, my name is Dr. Faña-Souchet, and I'm the medical director of AMA Medical Group. And one question that I get from my patient is, Dr. Faña, how can you diagnose COPD? And before we make the diagnosis, we want to say, what is COPD? So COPD stands for chronic obstructive pulmonary lung disease. And it's more common in patients that are nicotine users, smokers, because nicotine destroys your lungs. However, there is a small amount of patients that are not smokers that can develop COPD too. So that's important to mention, that some people have that predisposition and they've never smoked in their life. Usually patients have symptoms such as they get bronchitis, cough, fever, and shortness of breath at least 2-3 times a year. These are the people that are constantly coughing, they're bringing a phlegm, and they'll come to their doctors, they get treated with antibiotics, and then they improve. In the office, we do a simple test. It's called spirometry, where we make you blow in and out. We can measure the amount of air that you're able to inhale and exhale. Patients who have COPD, of course, they have limitation, and we can detect whether or not they have the capacity to not only inhale a certain amount of air volume per second, but also be able to exhale it. So it's almost like a balloon. When you inflate the balloon, it should be able to, when you release it, deflate pretty quickly. So the same thing happens with our lungs. Once there's destruction of your lungs, we cannot cure it, but we can stop the progression by really stopping the offensive agents, such as stop smoking. Smoking cessation is a big deal. It's something that we put a lot of emphasis in our practice, because if we can help our patients quit smoking and stay off smoking, they'll do much better. And no, we cannot cure them, but we can stop the progression, and sometimes that's all they need, and they may or may not need treatment. Treatment start from, we have simple, if they have no symptoms, we don't treat, because we don't treat results, we treat our patients, right? But once they start having symptoms of cough and shortness of breath, we have different kinds of inhalers. We go from simple inhaler to oxygen to surgical approach to improve their quality of life at that point as well.